Fever in babies and children can be an incredibly anxious time for parents and carers. And, we often just go straight to Google. And if you've ever tried Googling fever in babies, you will see that it comes up with some really strange stuff. So, how do you sort the fact from the fiction? Well, that's what we're here for, basically. We're going to help sort that fact and fiction for you. My name is Sarah Hunstead. I'm a paediatric nurse, mum of two, and founder of CPR Kids. And of course, I am joined by the fabulous Dr. Deb Levy, who is a paediatrician, mum of two, and we are bringing you this episode of Mother Doctor Nurse, where we are busting the myths around fever in babies and kids. So, how are you, Deb? On these fine.
Good. How are you?
Yep. School holidays are finished, or have your kids not gone back yet?
My kids only go back tomorrow, so you'll have to excuse if they do interrupt again, like last week or the week before. That very entertaining one.
That's all right. Don't worry. But it's all good. It's how we roll here because, we've got the kids, we've got the interruptions, and that's okay. Now, what we've done is that we have Googled fever and babies in a couple of the search terms, and we have come up with the most asked questions. So we're going to go through that today. What we would love you to do is tag anyone in the comments below who you think will benefit from this good information, and we want you to ask your questions. That's why we're here. So if there's something you want to know about fever in babies, please type it in the comments below. But remember, we can't give specific medical advice. So let's start with the number one. Okay, Deb, tell us, does teething cause fever?
I'm deliberating because we don't actually know the answer to this one. That being, when I went to medical school and all my pediatric training, I was always told teething does not cause a fever, does not cause a fever. Yet every single parent that you speak to will say, yes, my child got a fever when they were teething. And what I've come to, after many years of practice is this I guess, a compromise where I'm happy to put a low-grade fever down to teething, but anything that's high, I'm going, that's not just from teething. And what's a low-grade fever? Anything around about 38 degrees. So I think that if you've got a child who's niggling around about that 38, whether it's 37.9, 38.2, and they're obviously teething and, miserable with their mouth, then I think it's okay. Obviously it's something you need to keep that's my dog. Obviously it's something you need to keep your eye on for any other symptoms developing. But I think that's okay. A higher fever, no, that's not going to be from teething.
Okay, excellent. Thank you, Deb. Now, just a little caveat here. We're going to be answering these questions. We have done a really extensive fever video, which is what is fever? What should you do if your child has a fever? When do you need to go to the hospital? When do you need to worry? We've done that. I'm going to pop the link to that in the comments below so you can watch it. Just in case you're wondering, well, Sarah and Deb, why aren't you telling us what to do? Because we've done it and we'll post it down below. So we'll answer the questions today. Now, okay, next question. If I give my child paracetamol or ibuprofen, will it stop them having a seizure? Now, we're talking about febrile seizures here or febrile convulsions. So will it stop them having one?
No, it won't. What we think is that it's the rapid change in temperature that actually brings on the seizure. So not the height of it, and you just can't catch it in time is the bottom line. I guess, you can think, maybe if I put them on regular, medication, it'll stop the fever. But, the literature is such that, no, you can't actually prevent it.
Yeah. Okay. Excellent. And we talk all about febrile seizures as well in our other video too. Okay. All right, next question. And I think this kind of comes on to, tacks on nicely from that seizure question, is you have to bring down a child's temperature back to normal or they're going to get sicker. Oh, little Lulu's
I
joined
know
us.
she's recovering from surgery, and I was worried she was I've got a jump or something next to me, and then she's not allowed to do that. So I thought it's actually safer for her to come sit on my
Yeah,
lap.
good idea. Good idea.
Yes, sorry, you were saying about bringing.
If we don't bring down our child's fever back to normal, they're going to become sicker.
No. If you think about it this way, fever actually serves a purpose, and that purpose is helping your body fight whatever infection that they have. So there's a theory that you shouldn't actually, treat a fever as such in terms of, it could potentially prolong an illness, but I'm not 100% sure about how strong that evidence is. But certainly the fever itself doesn't impact on, how long the illness will go along.
Yeah, absolutely. And I think that's one of the big things that we always need to remember is that fever isn't the illness, it's our body's defense mechanism, it's our body's reaction to it, that's not the illness itself. And I think that's a really important thing that we've got to remember. So we've been talking about temperatures. First of all, this was a hugely Googled term, and that was looking for temperature charts on Google. So tell us, what's a normal temperature range in a child, and what would you consider to be a fever?
Well, I think every child is different. Some kids run hot, some kids run cooler. So, which is why I think it's one of the important things to do in your child as well. In terms of, and I'm not saying multiple times, just, a couple of times, take their temperature so that you know what their norm is. But I regard anything greater than 38 degrees as a fever. And it doesn't actually matter how you take it either. And I know that's something we're going to cover today. But so I think, anything greater than 38 degrees.
Yep, absolutely. And so thinking about that, there's lots of ways that we can measure a temperature in a child. So you may be doing it in the ear, you may be doing it on a forehead, you may be doing it under the arm or in the bottom, depending on, there are loads of different ways. However, there's two questions here, Deb, around how we measure temperature. One, what is pretty much the most practical and accurate way of doing that at home? And a lot of Googling out there says that depending on where you measure it, you need to plus or minus a degree. For example, I Googled just before that if you measure a temperature with a digital thermometer under the arm, that you need to add a degree to it. So why don't we start there with that question? Is it necessary to add or minus anything from the recorded temperature when you measure it at home?
Look, it's quite an academic thing about adding or subtracting. Usually just adding, because the gold standard would be an internal body temperature, which I guess the closest would be a rectal temperature. But let's be honest, I don't think there's any need at all to do that, on a day-to-day, basis. Sometimes we'll do that in a hospital scenario, but very, very unusual. So what we're looking at is, the other classic ways that families will take them under the arm, probably being the most common. And that's certainly what we do at home. When I take a temperature, I rarely take a temperature, which is another point I'm going to make. And, older children under the tongue, and then there's in the ear, the ones that measure, the quick machines. And I think the bonus of those ones, the benefit is that they are so quick. Whereas, those ones under the arm, it can feel like forever. And if you've got a wriggly little kid, it can really be challenging.
Yep.
And then the other options are the ones that go, it's like a strip that you put on the head. All I'm going to say about those is don't. Just don't use them. They're inaccurate. And rather either use the digital under the arm or the ear thermometer. And if you're going to use the ear one, I always recommend doing both ears and looking at the lower temperature.
Okay.
That being because if your child has got an ear infection, it can falsely read high.
Yep, absolutely. And you need to practice doing that as well, because you need to have good technique. And the other thing is too, is that a lot of the literature shows that there's a decrease in accuracy in young babies. So not using them in young babies, saving it until your child is older is a good idea in young
Meaning
babies.
the ear one, just to clarify for people there.
Yes,
Yeah,
the
that's
ear
fine.
one. Thank you. Yep. So that, and you need to have a good technique with it as well. So save it till when they're a little bit older. In young babies, do the digital underarm. And if you're looking for cost effectiveness and accuracy, you can't go past a digital underarm thermometer. $15 from the pharmacy. And, certainly the technology has improved in them a bit from when I started nursing, which is a long time ago. They're faster now. So, but of course, if you have an ear thermometer, that's not a problem at all. Do exactly what Deb said, doing it in both ears, and also making sure that you've got that good technique. Read the instructions and don't use it on young babies. So, excellent. So we talked about the thermometers and everything. So let's look at, the treatment of fever. Now, first of all, I don't really like the word treatment. That's okay, Deb. All good. All fine. So I don't really like the word treatment, because we're not treating the fever. We're simply relieving the symptoms of it, because we don't need to treat the fever. It's about the underlying cause. But it was one of those Google terms. So first of all, let's start with some physical cooling. One of the big Google things was, should I put my child in a cold bath? Tell us about that, Deb.
Absolutely not. It's a dangerous thing to do. The reason being that, again, rapid change of temperature, your child could have a seizure, and then it becomes a hazard, drowning risk, etc. So never, ever put your child in a cold bath. There's also the thought that the rapid cooling can actually increase the core body temperature. So it can backfire on you. So there you go. That's a quick one. No, never.
Love it. And what then also, there's the opposite that I saw recommended out there as well, that when your child has a fever, that we should rug them up in multiple layers so that they can sweat the fever out. Tell us about that one.
Certainly I've seen many families try this, and I think, look, I don't think there's anything that there's any evidence that it changes the course of the illness. But I think it just makes children feel very uncomfortable. So I wouldn't recommend it. I would say, in any child with a fever, strip them down to just like a light t-shirt or a light cotton onesie, not overly cold, but not overly wrapped up either.
Yep, absolutely. Yep, lovely. So they were some of the biggest search terms that we looked at. If anybody who's watching live now and you'd like to ask a question, please pop it in the comments below. But Deb, tell us, what else do you want people to know out there? Are there any other myths that you would like to bust while we're here?
There were a couple.
Sorry,
Sarah.
That's okay.
It's about giving Panadol, paracetamol, and ibuprofen together.
Yes.
I think that's fine.
Yep. Can you do that?
Well, look, you can do it, but there's no need to do it, because it actually doesn't increase the efficacy. So use one or the other. Usually I say try paracetamol first, and then if that doesn't help, within 20 to 30 minutes, if you don't notice that temperature coming down, then you can consider giving a dose of ibuprofen. So there's no need to give them both together. I guess the other thing is around, so what I was going to talk about.
Yeah,
Sorry?
I think we should probably say there as well that you don't need to bring their temperature back down to normal. It's simply about making them feel more comfortable. So it's not something that you have to do, and it's unlikely.
Oh my God, just hold on, Sarah. I have to go. Sorry.
No problem. It's all good, Deb. See, working with animals and kids, this is something. So as I was saying, one of the really important things is that we need to remember we don't have to bring their temperature back down to normal. Our body imagine that it's like a thermostat, that you've got the ambient room temperature and your body gets invaded by that virus or bacteria, and your brain, who's the control center, just goes, hang on a sec, this isn't good. I want to raise our temperature in here so that we can fight off this virus and bacteria. So our temperature is going to do that. And it's simply giving that paracetamol or ibuprofen is just going to bring that down to make them feel a little bit more comfortable, and unlikely that it'll bring it back to complete normal and for a prolonged period of time either. So for comfort, not cure. That's the important thing. So go ahead, Deb, what were you going to say?
The other thing I was going to say around, do we really need to take temperatures? I guess that's quite a controversial thing, and it's not really like myth busting, but I think the importance is around children who are very young. So certainly 100% under 1 month, and certainly under 3 months as well, if not under 6 months. I think it's important then to take your child's temperature.
Mm-hmm.
Otherwise, it's almost academic, I think, because you can see if a child's unwell, you know if your child's unwell, and the actual number, and you can feel, again, studies have shown that parents are accurate, by, I think they said about 2/3 of the time, and just, the forehead touch.
Yep. And the chest.
Or the chest, exactly, yep. That's central. And then yep. you kind of gauge it on that. I don't think the actual number means a lot. And I guess that brings me to one of the other myths is, the higher the fever, the more serious the illness. Mm. And that's not true. There's certainly some, benign viral illnesses. Like I just think of rosacea, the slap cheek, as the one that can cause that rosacea, where they get these really, really high fevers up to like 40 degrees. And then the next day it's gone, and this, the rash comes out. So, that does not indicate, a higher fever does not indicate an increased likelihood of it being a bacterial infection and a more serious infection. It really is the whole picture of your child, not just the number on that thermometer.
Yep, excellent. And that's really important that we remember that, because I think we can become fixated on what's on the thermometer and but fixate on that rather than looking at our child. Because a child can have, a low-grade fever and be very, very unwell.
Exactly.
Or a child can have a high fever and be okay. So it's one of those things where, yes, it is an indicator. And as Deb said, certainly under, 3-6 months, we want to know what that number is, because especially under 3 months, if your child has a temperature above 38 degrees, then they need swift medical help. And that's important. They need to be seen by a doctor.
And a low temperature can also mean infection in terms of that, can also indicate more commonly bacterial infections. So I think you got to be careful of those numbers.
That's exactly right. So that's it. Look at your child, know what's normal for your child. And if things aren't right, if your gut is telling you that your child is unwell, please always seek medical help. And if you're unsure, then just ask. There's lots of resources out there, from Health Direct to, your GP, your paediatrician. There's loads of resources. Please don't be afraid to use them. It's really important. So I think we might have finished with our myth busting today, Deb, unless there's anything else you'd like to add. All good?
No, all good. I was just looking to see if we had any questions come through.
No questions through at the moment, which hopefully means that we've answered everything really well, I hope. So that is a good thing. And we will be back again next week on the same time. So that is 10 a.m. next Wednesday. So 10 a.m. Australian Day. Tuesday. Tuesday. We will be back on
Tuesday. Do that to your brain.
Yes, they have. Tuesday, 10 a.m, and that is Australian Eastern Daylight Savings Time. Oh, God.
Thanks, everyone. Sorry for the interruption again.
See you.